Clinical rotation in anesthesiology for 9th semester students of the Faculty of Medicine. The anesthesiology clinical rotation in the 9th semester aims to train medical students to understand, implement, and manage anesthesia and pain control in various medical and surgical procedures. Students gain insights into the principles of anesthesia, patient monitoring, anesthesia administration techniques, and management of anesthesia-related complications. The focus also includes managing acute and chronic pain. 1. Objectives of the anesthesiology rotation. Clinical competencies understand the basic principles of general, regional, and local anesthesia. Manage preoperative, intraoperative, and postoperative patient care. Recognize and handle anesthesia complications such as allergic reactions, hypotension, or respiratory depression. Procedural competencies perform intravenous, IV, line placement for anesthesia administration. Understand the technique of endotracheal intubation. Assist in regional anesthesia procedures, such as spinal or epidural anesthesia, under supervision. Communication and collaboration. Communicate with patients to explain anesthesia procedures and potential risks. Collaborate with surgical teams, nurses, and anesthesiologists to ensure optimal patient management. 2. Learning structure and daily activities. The anesthesiology rotation occurs in operating rooms, OR, intensive care units, ICU, and pain clinics. Students also engage in preoperative preparation and postoperative monitoring. A. Preoperative preparation activities. Conduct preoperative evaluations, including medical history taking and physical status assessment. Use the ASA, American Society of Anesthesiologists, classification system to assess anesthesia risk. Inform patients about the anesthesia procedure and obtain informed consent. Objective. Understand the importance of thorough patient preparation before anesthesia. B. Intraoperative care activities. Assist anesthesiologists in administering general anesthesia, inhalational or intravenous. Observe and assist with regional anesthesia techniques, such as spinal, epidural, or nerve blocks. Monitor vital signs, including blood pressure, heart rate, oxygen saturation, and anesthesia levels. Objective. Train students to maintain hemodynamic stability during surgery. C. Postoperative care activities. Manage postoperative pain using pharmacological, analgesics, and non-pharmacological methods. Monitor patients for anesthesia-related complications, such as nausea, hypotension, or respiratory depression. Assist in patient recovery in the post-anesthesia care unit, PACU. Objective. Ensure patients recover safely from anesthesia and are free from complications. D. Pain clinic activities. Treat patients with acute or chronic pain, including neuropathic or cancer pain. Use pain management techniques such as nerve blocks, pharmacological therapy, or nerve stimulation. Objective: understand multidisciplinary approaches to pain management. 3. Types of anesthesia studied. A. General anesthesia induction. Inhalational agents like sevoflurane or halothane. Intravenous agents like propofol or thiopental. Maintenance. A combination of inhalational anesthesia, opioids, and muscle relaxants. Complications. Respiratory depression, hypotension, or intubation difficulties. B. Regional anesthesia. Spinal anesthesia. Used for surgeries in the lower body, e.g., orthopedic or obstetric procedures. Agents used: bupivacaine or lidocaine. Epidural anesthesia, for labor pain management or postoperative pain control. Delivered using an epidural catheter. Complications: hypotension, post-puncture headache, or infection. C. Local anesthesia indications. Minor procedures like wound suturing or small excisions. Agents used: lidocaine, prilocaine. Complications: allergic reactions, local toxicity. 4. Mastery of clinical procedures. Basic procedures. Develop an anesthesia plan based on the type of surgery and patient condition. Perform IV line placement. Monitor vital signs during anesthesia. Advanced procedures, under supervision. Assist with endotracheal intubation. Perform spinal or epidural anesthesia. Operate anesthesia machines and interpret monitoring parameters. 5. Diseases and conditions covered. A. Anesthesia complications. Hypotension, managed with intravenous fluids or vasopressors. Respiratory depression. Use mechanical ventilation or administer opioid antagonists like naloxone. Allergic reactions, managed with antihistamines or adrenaline. B. Chronic pain. Neuropathic pain, managed with anticonvulsants, e.g., gabapentin, or antidepressants, e.g., amitriptyline. Cancer pain, a combination of opioids, non-opioid analgesics, and nerve block techniques. C. Systemic conditions affecting anesthesia. Cardiovascular diseases, managing patients with hypertension or arrhythmias. Pulmonary diseases, adjusting ventilation for patients with COPD or asthma. 6. Learning methods. A. Bedside teaching. Students are taught anesthesia procedures directly in the operating room under anesthesiologist supervision. B. Case discussions analyze complex anesthesia cases, such as patients with multiple comorbidities. C. Clinical simulation practice intubation techniques using models or simulation mannequins. Training on the use of anesthesia machines and monitoring systems. D. Observation and participation. Observe anesthesia procedures during major surgeries like cardiac or orthopedic operations. 7. Assessment A. Daily evaluation. Evaluate monitoring and procedural skills during surgeries. B. Mini-CEX. Assess specific procedures, such as IV line placement or intubation techniques. C. OSCE. Simulation-based examinations for anesthesia scenarios, such as managing intraoperative hypotension. D. Logbook. Document cases involving anesthesia and pain management handled during the rotation. 8. Challenges and opportunities. Challenges. Complexity of cases involving severe comorbidities affecting anesthesia. Managing emergency anesthesia situations, such as seizures or hemodynamic collapse. Opportunities. Learning modern technologies like mechanical ventilation and hemodynamic monitoring. Gaining experience in managing patients for various medical procedures requiring anesthesia. Conclusion. The anesthesiology clinical rotation provides in-depth knowledge of anesthesia management and pain control. This experience trains students in anesthesia procedures, patient monitoring, and complication management. The rotation prepares students to face anesthesiology challenges in various medical contexts, including major surgical procedures and chronic pain management, with a safe and effective approach.